Hi, I'm Douglas Joyce, the founder and owner of the Joyce Vein and Aesthetic Institute. We are a state-of-the-art venous treatment center located in Punta Gorda, Florida. The procedures that we have developed at JVAI for venous disease are office-based procedures. What I mean by that is that it is not necessary for patients to be hospitalized, have general anesthesia, narcotics, or any type of sedation. They are able to come into our office, be totally awake, have a procedure done, and then leave immediately and go out and have lunch with no problem whatsoever, no limitations whatsoever, and very little pain during the procedure and very little discomfort after the procedure. Varicose veins, this term refers to prominent veins on the leg. What it means really is that those veins have dilated and that their valves are not working correctly and there is a pressure abnormality in the vein. When veins are under normal pressure because they're functioning correctly, they don't dilate. When veins are under abnormal pressure, they dilate. And when they dilate, they become prominent and they're called varicose. You see it in a lot of situations and a lot of things contribute to it. The things that contribute are occupation and even something as simple as weight gain can attribute to varicose veins or venous disease. However, losing weight doesn't cure venous disease. And the reason is because once the veins are dilated, they rarely go back. Varicose veins have abnormal flow patterns, and blood, when it flows abnormally, likes to clot. So you can get a clot in varicose veins, and that's phlebitis, the term phlebitis. And when you get a clot in a large cluster of varicose veins, you wish you didn't get a clot in a large cluster of varicose veins because it hurts and it becomes inflamed and hot and red, and it takes up to months to resolve. You know, it's not cosmetics. There is a danger that it will clot off, and you might as well fix it because number one, it should be fixed, and number two, your insurance is going to pay for it, so why not fix it? Patients with varicose veins will present a lot of times with the varicose veins as their complaint, but they'll also present with swelling of the legs, pain in the legs, heaviness of the legs. They'll talk about restless legs at night or their legs feeling antsy at night. And these are all symptoms of venous disease. People get pain in the leg because the veins swell and push on nerves that run with them. Sometimes they present with really unusual things like running water on their legs or electrical shocks on their legs or heat going up and down their legs. And the reason for that is because the nerves are stimulated by these dilated veins and they don't know what to do with the stimulation. So they create a scenario. Your brain creates a scenario and your brain says, well, the closest thing to that would be water pouring on your leg. It's easy to cosmetically treat venous disease. You look at what's on the surface and you remove it. You either take it out or you inject it or you shoot a laser at it and the patients look down and the leg looks good and they're happy for a short period of time. But it doesn't correct the problem. And so these patients have a high reoccurrence. So when patients come in to see us, we evaluate them, we take care of the cosmetic problem, but we fix the venous disease so it doesn't keep occurring. And insurance pays for us to fix it. So it's really a no-brainer when you get right down to it. It's been known that veins that are not functioning well, if they are removed from the leg does better. The problem with vein stripping is that it has to be done through incisions, and when you remove a vein, everything with a vein comes with it. So all the branches are ripped off, all the nerves that are around the vein come out with it, and no matter how good you are at vein stripping, and no matter how small an incision you can make to do it, it still is a majorly invasive procedure. As opposed to laser ablation, where we put a laser inside the vein and close it from the inside through a needle stick. These patients are not hospitalized, they do not require anesthesia, they're able to be functional afterwards, and all of the nerves and all the structures around the vein are never touched. They're left intact because it's done from the inside. To make an appointment, you're welcome to call our toll-free number, which is 866-998-1312, or visit the venous section of our website, www.jvai.com.